talking about belief versus skepticism and really navigating those doubts that you have about behavioral and mental health, including natural therapies. Let's talk about traditional versus natural therapies for behavioral and mental health, right? So, what do we think about traditional therapies? Typically, it's things like, I'm going to say medication. That seems to be the top of the chain of what we think about is the best treatment for medication. I'm going to tell you, I'm going to debunk that myth. But we also want to talk about therapy. And psychotherapy is incredibly important, whether it's one on one, it's parenting therapy, it is behavioral therapy. These are all really incredibly valid, scientifically proven effective therapies. Now, what why do they not work? Because they often don't work. And often it's because, you know what I'm going to say, we have a dysregulated nervous system, right? We have a stress activated nervous system. Until that brain is calm and the nervous system is regulated, you just can't think, right? You can't take action. You can't pay attention. You can't absorb. And that's why a lot of times there's a failure. And I know that's where a lot of times we reach for medications, but the majority of psychiatric medications are what's called off label for children. And please know I'm not opposed to psychiatric medication. I'm 100% opposed to it being the first line of defense. There are too many other clinically valid therapies, right? And that's why I want to talk about this belief versus skepticism and really navigating these doubts that you have, because you're not hearing about it. And why, right? You're not hearing about it because often the provider isn't trained. That is typically the biggest issue, right? I wouldn't be here talking about it if I didn't train myself. And why did I train myself? I trained myself because those treatments weren't working. And I knew that the brain and body could get better. And it didn't really take a lot of navigating to figure out, really just had to go to the, library. And back then in the early 90s, I had to look at microfiche and find research studies that showed things like what you ate, vitamin D, magnesium, different types of therapies really had a huge impact on mental wellness and behavior. So that is important to understand that there are lots of scientifically valid research studies to talk about a wide variety of what we call integrative or holistic therapies. And these therapies are often relegated into this area because the top of the food chain, right? Your pediatrician, your psychiatrist, right? These are the people that often are frontline workers for mental health. And a lot of therapists just don't know. Now, the tide is changing and people are learning more, right? But let's talk about why parent doubts happen. So this is probably one of the most challenging things that I find as a clinical mental health professional is managing doubts, right? So, of course, when you got a kid with stuff, you're going to wonder which path you should take, right? And if you don't have what you believe to be a trusted professional, an MD, or maybe your therapist sort of backing up and supporting you, you're going to feel a little uncomfortable about the road ahead. And this is what I want to say, right? So, are you comfortable with things being sort of okay, just getting by, maybe terrible, and you're trying all these solutions and they're not working, and you're continuing to do the same thing over and over? Are you going to trust that? Or are you going to trust your gut? Right? And you got to trust your gut, right? So if you've really given good effort, and as I like to say, you're not doing sprinkle therapy, you're not doing a little this and a little that, but you really have gone deep and you really have, spent 3, 6, 12 months really working on something, and you're really just not getting great results, right? And what does great results mean? It doesn't mean perfect, people. But it means that your child is making those steps towards improved behavior, self-regulated behaviors, right? So you're not as unfocused or angry or irritated, whatever is going on, you're seeing gradual change and you're all putting in the work. That's important. So let's talk about some of these myths that happen versus valid concerns. So yes, you should always be concerned when you're trying anything right? Whether it's psychiatric medication or a new therapist or, you're trying neurofeedback with Dr. Rowe. Of course, there's going to be some concerns, right? But don't let fear hijack you. When you commit to something and you have a trusted provider who has really expertise in that area, dyslexia, PANDAS, whatever's going on, you need to honor that process and be there, right? But when it comes to myths, there are a lot of myths that go on about it, right? Things like, well, diet takes a long time. That's one of the worst myths out there. And I know why it's there because it's hard to change your diet. But actually, some of these things, people will say integrative therapies take longer. That's not been my experience. When you prepare the body and you get that nervous system to self-regulate and calm down, those other treatments like great forms of psychotherapy or behavioral work actually occur a lot quicker. So we think that psychiatric medication is faster. Today, I had one of my old clients come back for a different reason, and they've like we're in a many years ago we're in a terrible crisis, and we had to work with them intensively, and have gone on and is an adult and stuff, and was coming back for something else, and of course they had a psychiatric consult, and the psychiatrist was like, "Well, I recommend meds." And luckily, the mom's like, they never worked for her. And, they had been fortuitous and had genetic testing, which showed that this person can almost couldn't respond to any psychiatric meds, but yet the psychiatrist still wanted to push them. That's against common sense. And the great news is the mom listened to her instinct, was like, we've been down this road. It didn't work. And in fact, worsened things. So always think about, what is my valid concern? What's the myth? And find an expert who really can guide you through this, right? I'm a big fan of Google MDing things. I'm not your typical provider. But you also really need an expert. Like, you can't do it yourself everything. You can't. You really need guidance, right? And I'm going to be talking a lot more about this in this unbelievable webinar. You go to drroseann.com/regulated, REGULATED. And whenever you're listening to this, you can watch this webinar. And we're going to be talking about natural therapies, how to regulate the nervous system, because if you're listening, you're watching this, we are really digging deep in self-regulation, because it doesn't matter if you're a student, if you're an employee, you're a friend, you're a mother, you're a partner. Self-regulation is hard in this world of anxiety and stress. And so we really want to support you in a multifaceted way. And of course, always the science-backed solutions. So I'm going to educate you and guide you to the right solutions. And so you can go to this unbelievable free webinar, which is going to occur in a couple weeks. So let's talk about the efficacy in natural therapy. So I did talk about quite a bit, over the years and all of my work. You can read my blogs. You can, go back and listen to these other series or watch it on YouTube. There's a lot of efficacy about nutrition, right? And just so we know, the number one diet for mental health, clinically proven, is an anti-inflammatory diet, and the most studied diet is a Mediterranean diet. But we also know that certain nutrients are unbelievable in powering the brain, including magnesium, vitamin D, essential fatty acids, and a bunch of others that I'm not listing, because otherwise I'd be spending all day talking about them. And these are important tools to help us, as well as brain based tools like neurofeedback, EMF, biofeedback. They're not just alternatives. These are effective ways to actually change the brain in a lasting way. And I think that's what's so different, right? Somebody is talking about, many prescribed meds have the opposite effect on a PANDAS kid. My son didn't have a good response with SSRIs. So, anonymous Facebook user, thank you for sharing that. It's always so helpful, because this is a scary journey. And even to make the decision to do medication is not an easy one. And I don't want to shame anybody. This is all about education, right? But we know through research that PANS and PANDAS, right? So, just for those of you that don't know what it is, it's when the body has an infection or a toxic trigger, creates a misdirected immune response. The body starts attacking itself. It produces a lot of inflammation and some scary neurocognitive, neuropsychiatric symptoms can result. And it is on the rise. They estimate that one out of every 150 to 200 kids have it. And many kids are misdiagnosed as having some other issue when it's really a medical source and psychiatric issues arise. So, SSRIs, psychiatric medications, all psychiatric medications. And, just because you're on Concerta and Adderall, you think you're not on Ritalin. It's the same drug. I love to tell everybody, blow your bubble on that. So everyone always thinks Ritalin's like the worst, like it's the worst of all of them. They're the same. They have what we call a kicker, is to when it a secondary component that the release time, right? So one is, kicks more in the morning, one is more in the afternoon or midday, or has double kickers. So we give out medication like it's candy, particularly ADD medication. Like it's kind of crazy actually how easily you can get a psych med, and they all have a toxic effect. They all have a long list of scary side effects. Many kids with PANS and PANDAS can have a real worsening of symptoms because it puts your toxic load too high. But yet, we're so much more comfortable and decisive about choosing a psychiatric medication than we are with neurofeedback. Like, please don't call me. And like, it's so unbelievable how this happens. And in the pandemic, it's so much worse. And say, prove to me this will work, and I get it. You're trying a lot of things, but you have to have a belief, and you also have to trust your provider. And there are evidence-based approaches, and neurofeedback is one of them. And I know that when people work with me in our brain behavior reset program, people get better when they follow the program, but they also have a sense of belief in themselves. And, I always say, in a belief in somebody else above, right? Having spirituality when your kid is having a hard time is essential. I don't know how people do it. Like my husband says, I look like I'm practicing Santeria in the morning because I light my candles. I say all my prayers for everybody in my family and the people that I'm helping. But yeah, for sure. So another person says, I wish I had known that then, but have learned so much from you and other national providers. Well, thank you. I've been getting a lot of nice messages about how helpful my work on natural solutions, but also on self-regulation is. So thank you, because, here I am. I'm at home today and I'm here talking, and I have some people, but it's nice to know that it's impacting you and that it's helping, because it is, as one special needs mom to another, or a neurodivergent mom, or whatever you want to call it, it is a lonely road. And, so many of our moms in particular are truly the one making all these decisions. And, I recently had a few moms come to me, and they're like research scientists. And, they were like, okay, I've done six different intakes with these providers. I'm going to try this. I'm going to try. I was like, hold on. You're working with me now in our brain behavior reset program one-on-one. I get to help you with this. And they're like, you mean you get to help me? Like, I don't have to just do this on my own. And I was like, no, it's like part of my magic juju. I'm like a great strategist about when to do certain things. So, we have to understand that natural therapies work. Yes, many of them do take time, but everything takes time. We've somehow believed that, again, there's a, magic wand and something just works. And that's why a lot of people do meds out of desperation. I find that to be one of the greatest treatment decisions people regret. And I don't say that lightly. Now, do people regret therapy? No. But do people feel like, wow, maybe this isn't the right time? Absolutely, because they're seeing their kid being too activated. You got to calm that nervous system the heck down, right? So it's really about making empowered and informed decisions. I know when I work with people, I make sure to say to them, you are in charge. Like, you are in charge of all the components of your family mental health and wellness. And I know it's scary, but I'm going to guide you, right? I can be that captain, and you can be on that cruise. But ultimately, in the end, you have to, investigate these things, find a trusted provider, and actually put one foot in front of the other and do the work and make a commitment to it. And I think that's the hardest part. I see so many people get caught in analysis paralysis, and then they're afraid, is my kid going to do it? How long is it going to be? What is it? Now, the great part about natural solutions, if you're really picking the right solution for you, um, it is not only effective, but most natural solutions are safe, right? And again, this is where you need guidance. Like sometimes people come into me and they're like on, like Googled every supplement in the world and they didn't think it through. And some of them counteract each other and, cancel each other out. And, but in general, a diet is not going to hurt you. Neurofeedback, I think we're 60 years now, 60 years of research to show how effective it is and safe. Biofeedback ain't not nobody ever been hurt by biofeedback. It's really breath work. So you can move into things that maybe feel safer to you. But you've got to take that step. So if you're interested in finding out what the natural solution is for you, you can go to our solution matcher, drroseann.com/help. And I hope this was a good conversation where you really got to say, yes, this is an efficacious, these are therapies that work. And I can do it. So yes, so this is a mom that's saying, it's hard to find a provider. I know it's hard to find a provider. Like they've done a lot of things on their own and she's had to take charge. Very sadly, that is the case. And just so you know, anonymous Facebook user, in 2024, I'm doing a lot more training. We're just setting up a PANDAS CE-based training for mental health providers. And Dr. Rowe is going to do a year-long mentorship and mastermind for providers. And it's not just going to be mental health providers. I actually have medical providers who really want to do it. So I know that I need to have my part of it and I need to train more people, but we do need more providers who not just are literate, but actually really not scared to work with complex cases. I love complex cases. I say it all the time. I'll take any case. Just don't give me a parent with a bad attitude. So we will screen you if you're nice, just so you know. My people know this. So we've worked with the nicest families. I don't care how messy it is, but got a great attitude. And a good attitude, it can be so helpful because this is hard stuff. So finding the right provider may not be easy. There are more providers getting trained, and that's an essential part of it. And it will help you feel less doubtful and more secure. I know that most of my people who work with me in our brain behavior reset program, the first 3 months, a lot of people, they're holding on in the roller coaster and they're so scared. And then once they see their kids start to regulate, it's a release, and we get on that roller coaster with a lot of baggage. So, we talked about a lot of different things, but trust in the process of natural therapies, get started, pick one darn thing. Maybe it's my magnesium, maybe it's one of the courses, whatever it is. Maybe it's focusing on, eliminating one food. Do it and get started. But don't expect a miracle overnight. And you really have to look for micro changes. So sending you all a lot of love. I'm in this ride with you and, you all can do it, right? It's going to be okay. We take a step towards natural solutions.